Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Hi, Scandalized listeners. Charlie and Jackie here with a really exciting announcement.
We're coming back to Podfort in 2026. We'll be live at the Boise Contemporary Theater on Friday, March 27th at 3 p.m.
This year, we're going to be digging into some of the juiciest fashion faux pas in American politics. You won't want to miss it.
We'd love to see our amazing listeners, so bring your friends and come talk scandals with us. And best of all, it's free.
That's Friday, March 27th at 3 p.m. from the Boise Contemporary Theater. See you then.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. When most people think about climate change, they often picture heat waves, storms, even wildfires. But there's another consequence that's drawing attention from doctors. It's the spread of infectious disease. And as the climate changes, the habitat for mosquitoes and ticks and other disease-carrying organisms are shifting, and they're bringing illness into places they've never been before. Joining us now to talk more about these trends and possible solutions is Dr. Preeti Jaggi. She's Director of Antimicrobial Stewardship at Children's Healthcare of Atlanta. Dr. Jaggi, welcome to the program.
Thank you so much for having me.
So climate change and infectious disease are not topics that people often naturally connect together. So how are these two issues linked?
So I want to actually start by talking about this kind of concept of One Health, which is the idea that the health of humans is integrally tied with the health of animals and our shared ecosystems. And the original idea of this concept of One Health came from people who are working in the area of infectious diseases because they were seeing that one infection could be carried from an animal to a human. And we become really, really recognizing now that we also all depend on our shared ecosystems. So the soil that we're exposed to, the water that we're exposed to, and as you're saying, the ticks and mosquitoes that we're exposed to. So all of those things are shifting now as our climate changes, and that is creating a lot of changes in kind of what we were expecting as far as what the types of infections we were seeing in different areas of the country and in the world.
So what are some examples of diseases that have become more common or that they're spreading into new regions because of climate change?
I think one good example is Lyme disease, which is tick-borne, and it has seemed to shift in the area that it is affecting. And so sometimes in some areas, you may not be quite as cognizant about that disease as if you were coming from the eastern seaboard. The other things that we see some more fungal infections sometimes after wildfires. That's been reported in California. There's some things that we don't typically think about too much, but if we have extreme storms, we can also see a little bit more diarrheal illnesses in people because our waterways are getting overwhelmed when we have very, very extreme storms that are dumping a lot of rain in a short period of time. And then, of course, mosquitoes can breed in water too. And so there are certain diseases that are mosquito-borne that are also changing location and spreading, like something called dengue virus, which is a mosquito-borne illness.
So can you talk a little bit more about like a mosquito-borne illness and that kind of impact and what it means for the health of humans then, especially as you said, you're seeing these infectious diseases in areas where we haven't seen them before.
Mm-hmm. So the mosquito is some people actually say that it is the deadliest animal in the world because it carries so many diseases like malaria and dengue. And we know one of the real big things that we're going to need to think about is the temperature. It turns out that mosquitoes also have an optimal temperature in which they can breed quicker. So there's going to be some areas where some of the types of mosquitoes that we see that are transmitting certain kinds of infections may change, and maybe a different type of mosquito might be more prominent in that area where it wasn't before. And then we do know that the standing water is what can breed mosquito. So we have a lot of illnesses that we see during the summer months, might be mosquito-borne viruses. And then I do think what we will see some changes in where we see malaria. Atlanta, actually, where I live, was originally the CDC came here because this was a pretty big area for malaria. We don't have as much malaria now, but relatively recently there was some local transmission of malaria in southern Florida. So we may have to keep watching to see what happens with that over time. I think for me, what I would say here is that we're going to have to probably expect the unexpected. We may have to become more cognizant about diseases that we're not as familiar with, depending on our geographic location, because things may move.
Oh, what about certain individuals that might be more at risk? I mean, children, the elderly, or could, because this is spreading into areas where, people haven't seen it, does that potentially make everyone, at a higher risk level?
I think certainly I always think about some of our most vulnerable in our community are the very young and the very old. And then I think the other people that are going to be at more risk are people that spend a lot of time outdoors. They're going to be people that are going to be more exposed to some of these ticks and mosquitoes, depending on how much time they're spending outside. So one of the things that we do advise people to do is for tick-borne illnesses to try to do frequent tick checks if you spend a lot of time outside, because many illnesses, the tick needs to be on you for about 24 hours before it is going to transmit infection. So doing a good tick check on yourself could help you. But I do think those that are spending a lot of time outdoors, of course, anybody that has a compromised immune system, and then the very young and the very old would be
Mhm.
probably some of the people that I would be most concerned about.
I want to talk now about antibiotic resistance because this is a growing global health threat. And I'm curious about if climate change at all makes the problem of antibiotic resistance infections worse.
So that's a very good question. I think we're going to need a lot more research into this area, but there are certainly some theoretical things that would make that connection be very, very plausible. So, for instance, again, when we know that antibiotics are unique drugs in that we will give them to a one person, and then the byproducts of the antibiotic gets into the environment, and then that can spread from person to person. So we know that antibiotics, are not like something like taking ibuprofen or Tylenol. It's something that can affect another person. And we know that even agricultural use of antibiotics can potentially affect human resistance. So that is certainly a possibility. And then I also think that when we are having extreme weather, like extreme storms, then our
Mhm.
waterways get overwhelmed. And so that can spread any kind of infectious agent. And so be it a virus or a bacteria. So I think there are definitely some risks there. And we do know that there are some um, germs, like something called Candida auris, which is thought to grow better in warmer temperatures. And so some of these organisms will probably also grow more because of warmer temperatures. There is one more example that I'd want to give, which is certain infections, again, on the eastern seaboard, called one called Vibrio vulnificus, and it's a waterborne, and the warmer water is actually increasing that. And so then what happens is that we use more antibiotics, and then we know that that can affect antibiotic resistance. And so it's kind of all sort of connected, in a sense that we respond with antibiotic agents, and then those antibiotic agents can then lead to resistance.
So there's a term called antibiotic stewardship. Can you tell us what that is and why it's important for both patient health and the environment?
So the term antibiotic stewardship was coined in 1996, and it was the idea that we should be using antibiotics wisely. That, we thought about a lot of the benefits of antibiotics initially when we started using them since the 1940s, and but we weren't thinking about some of the harms. And so that term antibiotic stewardship was coined. And we have made a lot of progress in antibiotic stewardship over the years. We now have antibiotic stewardship programs at each acute care medical facilities to make sure that we are using them wisely. And we're starting to learn what's the safest minimal duration that we can give to patients. When do we not need antibiotics? Trying to educate patients about when we should not be using antibiotics. And actually, we've made some good progress, particularly in antibiotic use in children. And we know that in certain areas of the world where they have had a lot of antibiotic resistance from specific germs, that when we use less antibiotics, some of that resistance goes down with time. So using antibiotics wisely is really basically what antibiotic stewardship is. And that is for any type of antibiotic if it's used for a person in the outpatient setting or in the inpatient setting as well,
Mhm.
in a hospital setting.
So we've talked on our program with previous healthcare providers about the fact that healthcare itself can contribute to climate pollution. So
Mhm.
could better antibiotic practices maybe help reduce, healthcare's environmental footprint?
Absolutely. So we know that of all the greenhouse gas emissions in the United States, about 8.5% is from healthcare delivery. And we know that the biggest single chunk of our antibiotic of our greenhouse gas emissions is from the goods, services, and supplies that we use. And of that, the biggest chunk is pharmaceuticals. And so, if we are using our pharmaceuticals wisely, we can decrease the impact. And so, somebody actually did a paper about this, a published paper about the unnecessary antibiotics that were prescribed back in 2014 to 2015, and they estimated the greenhouse gas emissions that were associated with those unnecessary prescriptions. And it turns out it was the equivalent of circling the globe in a gas-powered vehicle, 100 times. So it has actually a really, really big impact. So every drug that we use counts. So we can definitely decrease our emissions by being better stewards of the drugs that we are using, of which antibiotics is a really important part.
I have two questions left for you. And the first is this: what infectious disease trends are you most concerned about when you look out to the next 10, 20 years as the climate continues to change?
Yes, I'm concerned about a lot of different infections, and I'm concerned about us not kind of needing to expect the unexpected, seeing an illness that we don't typically see. A lot of what we do in infectious disease is based on our geographic location. So we see certain types of illness in certain type of geographic location. And as that changes, we're going to have to I think that sometimes we're going to be caught off a little bit off guard that, hey, we don't usually see this in this area, but we have to start looking for things that might be a little bit less common in that area. I'm also concerned about also some of the things that we see all the time. Anytime we have extreme storms and things like that, we might also have crowding. And when we have crowding, we can see viral illnesses get really bad. So influenza, for instance. We can see diarrheal illnesses. We can see, in certain areas of the world, typhoid. So I'm concerned about how some of those crowding conditions or unexpected weather conditions or warming will lead us to see more of what we commonly see and also things that we might think are unusual for our particular area.
And before I let you go, for folks who can become really overwhelmed when they think about climate change and then on top of it these infectious diseases, what gives you hope in terms of progress when it comes to healthcare and medicine in light of climate change and what we're seeing?
What gives me hope is seeing people work on whatever is in their locus of control. I've been working a lot on healthcare sustainability. We've been working on, decreasing drug waste and optimizing, trying to use drugs that are not IV, or, by giving them by mouth wherever possible, because that can decrease a lot of the resources that we need and the supplies that we need. And I think that so much of us actually can do small little systems that we are a part of. And when we start doing that, it gives us something that we can actually control. I think when you think about climate change occurring, it can be so overwhelming. But where I find hope and joy is working with the people that I work with in my system to try to make just even something a little bit better. And I think if we start working on that, it can make us feel a little bit less overwhelmed.
Well, I want to thank you so much for taking time to speak with us. We've been talking with Dr. Preeti Jaggi, Director of Antimicrobial Stewardship at Children's Healthcare of Atlanta. And we've been discussing the impact climate change is having on the spread of infectious disease. She did speak earlier this month as part of the St. Luke's and Idaho Clinicians for Climate and Health's lecture series on climate and health. We'll make sure to put a link to that talk on our website, boisestatepublicradio.org. Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. If you're really enjoying this show, a quick rating or review on Apple or Spotify really helps other folks discover us, and we'd appreciate it.
Boise State Public Radio and Duck Club Entertainment present the Charlie Hunter Trio.
Charlie Hunter Trio, everybody.
Wednesday, March 18th at the Shrine Social Club in Boise. Blending jazz, funk, blues, and rock, Hunter is a guitarist, producer, and bandleader who will present his unique finger-picking technique on custom hybrid guitars. Tickets are available now at theduckclub.com.